My name is Stacy Lacus. I'm a therapist at the Eating Disorder Residential Adult Program. In the adult program, we have up to 6 residents on our caseloads, and that can vary depending on admissions and discharges. We work with our individual residents, seeing them twice per week in 1-hour sessions. Sometimes that includes just individual work, and sometimes that will include a family session with their parents or significant others.
Perfect. Thanks for coming to session.
Yeah.
In addition to that, we work on case management, such as finding outpatient providers or step-down programs and contacting referrents, so updating the people they have been working with on how they're doing. And we also facilitate DBT skills groups weekly. When you're a therapist at Rogers, you'll utilize dialectical behavioral therapy and cognitive behavioral therapy on a daily basis. Our residents receive dialectical behavioral therapy groups weekly. These are skills-based groups so that they have an opportunity to better support themselves when they're outside of treatment. And this includes being more mindful, having better boundaries through interpersonal effectiveness, working on emotional regulation, and then distress tolerance. These skills are utilized by our residents daily, and it is imperative that they work on these while they're in treatment with us so that they can be more successful when they leave. In regard to cognitive behavioral therapists, we collaborate with our behavior specialists who facilitate most of the CBT work here. However, we do support through exposure work and understanding just how those anxieties and life stressors and fears impact our residents day to day. So working for Rogers, a lot of benefits come from the fact that we have many different levels of care. We have inpatient, residential, partial, and IOP. This allows our residents to have more access to services. So if someone comes here and is struggling, we can facilitate a transfer to the inpatient program to get their needs met better. They can get treatment in a way that we couldn't facilitate at a residential level of care. And likewise, when they're done in this program, we can step them down to our PHP and then our IOP programs. So it gives a lot more cohesive approaches to client care. A lot of times you'll find there's difficulty in getting people into services in different states. So Rogers works really hard so that people have that option to get their needs met in one-stop shop if possible. One of my favorite things about working for Rogers is the fact that we have multi-disciplinary teams, which that means is we have therapists, behavior specialists, dietitians, experiential therapy, nursing staff, psychiatrists, and psychologists all on site. With this approach, we're able to collaborate on our patients' needs and take a more all-encompassing approach than if you were to work somewhere other than Rogers Behavioral Health. Discharge planning in each level of care at Rogers looks a little bit different, so it's important to know that on our inpatient programs we have discharge planning support. However, the therapists do facilitate some of the discharge planning process. In residential, the therapists are the sole facilitators of discharge planning, which includes making appointment, contacting programs directly, and then in our partial programs and IOP, therapists are also the discharge planners. As a therapist, it can be challenging to also have to come into a new organization and learn the computer system. It is overwhelming for most, and I would say it's something that is over time easier and easier to acclimate to. So understanding that there is a lot of paperwork that needs to be done. However, we also understand as team members of these new individuals coming to work here that it takes time, and our expectations are you just ask questions, you let us know what you need, and then we can help you learn in that process. You're not alone. We've all been there. We've all had to learn the computer system. So it takes time. And again, knowing that you have the availability to work with your team on understanding how our documentation works versus feeling like you have to go it alone and then struggle and fail. When it's all said and done, I've stayed with Rogers this long because I enjoy being part of residents' process for learning, growth, and change. You have an opportunity to see someone at their very worst and be part of what helps them get back to their life, and it is truly rewarding to see that day in and day out.